What is the difference between an upper and lower blepharoplasty? Essentially, upper blepharoplasty refers to adjustments made to your upper eyelid, while a lower blepharoplasty refers to adjustments made to your lower eyelid. With upper blepharoplasty, usually a small amount of skin of the upper lid that is excessive and that may be causing vision problems is removed, and this leads to further exposure of the upper lid and the restoration of a youthful appearance. Furthermore, removing this excess skin may improve vision. When it comes to a lower blepharoplasty, it is adjustments made to the lower lid. Usually this can be seen as the bags under the eyelids. There are numerous ways of managing lower lid issues. These include just removing the skin, resetting the fat pads, and in advanced cases, even doing something called a mid-facelift in conjunction with a lower blepharoplasty. In short, these are both techniques that alter and improve the appearance of the upper lid and the lower lid, and in certain cases, not only do they improve the aesthetics, but they may also lead to an improvement in vision. Who is a good candidate for upper blepharoplasty? A good candidate for upper blepharoplasty generally has excess skin in the upper eyelid. This excess skin sometimes may even impair vision. Who is a good candidate for lower blepharoplasty? A good candidate for lower blepharoplasty is anyone who has obvious prominence of the lower lid fat pads or any excess skin in this area. There are a number of ways to treat lower lid deformities. These include repositioning the fat pads, excising skin, a combination of these procedures, and in the most extreme cases, performing a mid-facelift through a lower blepharoplasty approach. How long will an upper or lower blepharoplasty last, and will the procedure need to be repeated? It is difficult to predict how long the results last, as this is individual to each patient's tissues. In general, an upper blepharoplasty can last anywhere from 5 to 10 years, and lower blepharoplasty can last a similar length of time. However, that said, the tissues of the upper lid and the lower lid are quite thin, and resetting them is a challenge, and there is always a possibility that as you age, it may loosen, and therefore you may be a candidate for the procedure. What is the recovery like following blepharoplasty? Following blepharoplasty, you will have bruising and swelling, and around 50 to 60% of this bruising and swelling will settle down at around 2 weeks' time. This will be the majority of your bruising and swelling, and over the next few weeks to months, the remaining swelling and bruising will settle down. Of course, this is individual to each patient, and the timeframes I'm mentioning are a rough estimate. It is always possible that you may have significant bruising and swelling beyond the 2-week period, or it is also possible that it may settle down much quicker than this. In my experience, I find that bruising and swelling majority of the time settle down within around 2 weeks, but for the last bits of swelling and bruising to settle, it may take another 2 to 4 weeks. What is the cost of an upper or lower lid blepharoplasty? The cost of an upper or lower lid blepharoplasty depends upon several factors. These include the complexity of the case, the goals that you want to achieve, the surgical maneuvers required, and the length of time that is required to perform the steps to achieve your goals. There's also the need for specialist equipment sometimes, and also specialist materials, which may add to the cost of your surgery. There's also the option of patient finance, which can be discussed with one of our patient coordinators should you wish to pursue this route.